This is the Board of Health meeting, October 3rd, 2024. We're meeting, I don't know, what is this, room 101?
Yeah.
Okay, present at the meeting, I'll just go and introduce myself and everybody else. Sue Braska, Tom Hibbert, our health director, Samantha Grundon, our secretary. On Zoom, we have Dr. Labiniak, and then we have, don't tell me, we have Meredith O'Leary, who's the director of the Pioneer Valley Tobacco Coalition, and Lisa Stevens of the Mass Municipal Association Tobacco Control Program. We are waiting for Dr. Putnam, who should be joining us soon. And from the public, we have Erica Prouty. Did I cover everything?
Yeah, we have one other person that's called in. Lila Gibson.
Okay, Lila Gibson. So, any public comment before we start? We will talk to Meredith and Lisa when we get to the tobacco stuff. But, is that Terry?
That's Robert Melvin.
Okay. So Lila, do you have anything you want to say, or Robert, do you have anything you want to say during the public comment period?
I'm just observing, ma'am. Thank you.
Okay.
Same with me, thank you.
All right. So the review of the minutes. Did you get to look at the minutes, Trish?
Yes,
All right, I made a few little corrections, like added Mr. Hibbert instead of Hibbert.
Yeah.
And then a few little grammatical things. Do you have anything you want to add?
nope,
How about you, Tom?
nope, there's nothing.
Right, do you want to make a motion to accept the minutes from August 29th, 2024?
Sure, can I make a sorry, my voice.
Okay.
I'll make a motion to pass the minutes from August.
All right, and I second that motion, and Sue Braska, all in favor, Sue Braska, yes.
Yes, for Trish.
Okay, okay, so those are all set to go. We don't have Tricia on for the nursery report,
No, she had a family thing, so she couldn't,
Okay. so we do have Tricia's nursery report, a hard copy of it. Did, Trish get a copy of the nursery report, and, Terry?
Yep.
Okay, so the nursery report, I guess we're just gonna file unless you have any questions on it. Trish or anything?
Nope, no questions.
Okay, so Terry,
Oh, there we go.
oh. Hi, Terry, can you hear us?
She's muted.
There we go. Is she muted?
Okay, she-
You're muted.
Up, hold on. I didn't think so. No, let me
Okay.
turn up because I'm not muted.
Oh, I hear you.
Now.
Okay.
So we got past the nursery report. Now we're gonna talk about the tobacco regs, and we have on board Meredith O'Leary and Lisa Stevens, good night or just good night, to join in our discussion. Who wants to start off?
I can introduce it and then we'll
Okay.
go from there.
All right,
So we have our draft that we had accepted at our previous, I think, was it our July meeting? And last week, Kayleen and I met with Meredith and Lisa, just to talk about the regulation and see if there was any issues. So there were kind of two main, overall, it was pretty good. And the two main things that we had talked about was whether or not we wanted to add in the restriction for oral nicotine pouches to be sold in adult-only establishments. And also whether or not on page, in the violation section, I think it was page 10, page 10. We say for the second and third violations, the Board of Health may suspend the permit for 7 or 10 days respectively. So the recommendation there was we should consider changing it to shall, which I think makes sense because it just kind of removes that choice on the behalf of the board. It's more consistent across the board. We won't ever get into that situation of in one violation, we choose not to do the suspension, and the next one we do the suspension. And with a fairness, it's I think more fair across the board to say shall, and then they did the violation and that's the punishment and that's that. So I think that makes sense, but though I think those were the two big things. I don't know a ton about the oral nicotine pouches, so Lisa or Meredith, I don't know if you have anything you want to add about either of those issues or anything else.
Sure, I would be happy to. Hi, everyone. I've met you all in the past, but just a reminder, I'm Meredith O'Leary. I tonight am wearing my hat as the Pioneer Valley Tobacco Coalition coordinator, and I help provide TA to boards of health and health departments around policy work, tobacco work. So as part of our work, we have tobacco compliance officers that go into these stores on a regular basis. We have over 400 stores in our collaborative, and they do education visits, inspection checks, and they also do youth compliance checks. And we're always reporting, they're reporting back to me, which I'm bringing that information up to the state about what we're seeing in our store, any types of trends. And as of late, the new trend that we're seeing explode, like we saw Juul explode back in 2019, 2018, is we're seeing these oral nicotine pouches being utilized, especially by youth. I want to say about 6 months ago, we started observing more of them, the presence of them in our stores. And now I know stores are having difficulty getting them, but the stores that do have them, they have multiple brands of them and multiple shelves of them. And again, these are very sleek, small little pouches that are very discreet to use. They're very inexpensive, and they have a lot of nicotine content in them. I've seen them up to 35 milligrams, and the 1 tin of these pouches on a lower milligram base, nicotine gram base, is equivalent to 2.5 packs of cigarettes. And kids are using them for adrenaline rushes. So again, what we try to do is really curb youth initiation to these type of products. So a lot of our PVTC members are updating their regulations to include restricting oral nicotine pouches to adult-only establishments where you have to be 21 and show your IDs even to walk into the establishment, because there is smart marketing around these things as well. Lisa, do you want to add anything, or board members, do you have questions for me?
No, that was pretty explanatory, self-explanatory. I mean, you did a nice job. Thank you.
You're welcome.
And I can introduce myself. I'm Lisa Stevens Goodnight. I'm the Director of Tobacco Control at the Massachusetts Municipal Association. And we represent the 351 towns and cities in Massachusetts. And in my role, I provide technical legal assistance to cities and towns on tobacco control and enforcement policy. And so I can answer, and I also helped draft some of the language and the regulations. We put out like a model set. So I can help answer any questions you may have. Meredith did a great job with the nicotine pouches, so it doesn't sound like I need to answer any questions there, which is great. But yeah, so that's why I'm here, and I'm happy again to answer any questions you guys have. And if I don't have an answer, I can always, get back to either come back to see you guys or, get the answers to your health director. So, and then the last kind of caveat I always have to say is that while I do offer legal assistance, I'm not your attorney, so you always want to talk to your town council if there's a specific legal question.
Okay, we don't have any adult-only establishments in town, correct?
Correct.
So therefore, if we did this, we'd be hurting the adults. We're trying to quit. I think we talked about the same issue.
Yeah, I don't think I don't think we went too in depth when we talked about it, but yeah, it would
Right.
effectively be a ban unless someone was to open an adult only establishment.
Which we don't have in town.
Right.
What are your thoughts, Terry?
I mean, is there a way to, and pardon me if I'm asking a question that's pretty obvious. Is there a way to restrict the nicotine as though the nicotine pouches as though in the same manner that we restrict cigarette sales?
What is, you have to be, oh, and how old are you? How
To
old
use?
are the pouches?
21.
Okay, so it's still,
Just like
it's
any-
restricted. It's restricted for youth.
If
Are
I just
there-
may add something, that these nicotine pouches aren't, there's no science that they're being, that they are a nicotine cessation product, an approved nicotine cessation product. So, yeah,
So you're saying that they're not they've not been proven to be a substitute?
yeah, yeah.
Okay.
Mhm.
But they're not, but they haven't been proven not to be a substitute.
So
And if
no,
it's
so
restricted and it's restricted already that you have to be 21 or over. I don't see the,
So I can talk a little bit about like kind of what was the thought, like why we put this in, and one of the concerns that we have is just the growth that we've seen around these products. We know that while many products are restricted to under 21, sales do happen to people that are under 21. So you know, there is youth initiation under 21, and again, these are one of the products we're seeing kind of the fastest growing. There's also, in terms of the cessation question, so they are not an approved cessation device product. And on top of that, so there's kind of there's different levels of nicotine, obviously, in different products. These we've seen kind of the standard ones most people see are Zyn, which is 6 milligrams and 8 milligram amounts. But as Meredith said, we've seen products that go all the way up to 35 milligrams in a pouch. To put that in comparison to like approved cessation amount products, Nicorette gum comes in 2 and 4 milligram doses, basically. So this is in terms of just the amount of nicotine being delivered is substantially, some of these are substantially higher, like 10 to 20 times as much nicotine as a cessation device or a cessation product would have. And one of the other concerns is that because they are so discreet, they're so easy to use, without people seeing, that it's almost impossible once they're in the hands of especially youth to try to track or like tell if they're using them. So the goal is to get them as much out of the hands of especially young people, but also you see kind of the ramping up of people using these higher nicotine amounts, and that's always a concern.
And I guess my other question would be, and Trish and Sue, don't let me monopolize, is what are other towns doing right now? Is this something that's being implemented in other towns? Not that we have to do what other towns are doing, but that does help us, see what the trend is.
So the language that you guys are looking at was first put into the model regulations, I think, over the summer. I'm trying to remember when we actually distributed them. I've looked at them for so many times. I'm trying to remember when we actually like handed them out to the programs, but it was in the middle of the summer. And there's only one town at this time that has gone through the process of adopting the language. They kind of were like just starting the process when we gave out the new model regulation. So they were kind of the first one in there. There are a number of other towns that are considering this language. So you wouldn't be it's unlikely that your town would be alone, but you would be kind of one of the first ones just because of when the language was put out and when you guys are doing your update.
Trish, what do you think?
Sorry, it's going to be a little hard to hear me, but I think that these pouches appear not to be approved by the FDA, and they also appear to be not recommended by the CDC as well. So knowing those two pieces, I have to agree that these should be only in adult locations.
Or did you both get the correspondences from Peter Brennan and Jeffrey Smith?
I just got them now because I couldn't open the folder. So I have not. I think I got a separate email from Tom, but I'm just
Yeah.
getting it from the hospital, so I have not. I have not had a chance to look at those.
We can always say if we don't want to ban nicotine pouches. As time goes on, depending how things go, we can always revamp our regs.
Correct.
Lisa, do you know if the town that has adopted this restriction, did they have any adult only establishments in their town?
They did not.
They did not, so they're
Is it-
the same boat as us, okay.
Is it Northampton?
It's Orange, the town of Orange.
Okay.
Okay.
Lisa, Greenfield has adopted it as well.
Yes, Greenfield has.
Mhm.
And as I said, I know, trying to think, September was a kind of a crazy time. A lot of people are updating their regulations right now, so I can't off the top of my head remember which ones are, but I haven't had any town say that they're not considering this in the regulation
Yeah.
update, I guess would be the way I would say it.
Okay.
Um,
Well, I
I
certainly,
would've said-
I'm being pediatric and OB in background. I can certainly understand the need to restrict because and it is hard. Kids have a hard enough time without being introduced to stuff that's really going to impact the rest of their lives, and hard for parents to track. So I would like to consider. We don't need to make a decision tonight, right? Or we'll go into.
Yeah, so I'll just sorry to cut you off a little bit, but just to clarify for the board members and everyone. So we still have our public hearing for this draft regulation is next Thursday. So I think tonight we can kind of see where the board's at and regarding these two changes, the may and shall, and if we want to add in the language of the nicotine pouches. If the board does decide to do that, I will update the draft regulation that we have posted on the website. And then we'll still have the public hearing, so anyone who is against the regulation, for the regulation, whatever, will still have their chance to be heard at the public hearing next week.
And so what, thank you, I'm sorry to interrupt you, but right back at you, Tom. So how do we define youth? How are the towns defining youth? Because what we don't, if we discuss it and we decide to go to whatever our decision is, what we don't want to have is an undue burden on our town businesses, because now we're going to introduce yet another age that they have to worry about. So how are we defining that? How is that defined, Meredith or Tom?
In the draft tobacco regs, the definition of an adult only retail tobacco store, which is where the sale, if we adopted this language, where the sale of the nicotine pouches would be restricted to. It's on page 3 of the regulation. If you want to look at it, it's fairly lengthy, so I'll try to summarize it without going word for word, but it's basically an establishment that it's not part of any other business. So even like a liquor store, technically would pretty much mainly be just people 21 and older. That's not within the definition. So in essence, it would be like a smoke shop that could sell the nicotine pouches. And it would be restricted to anyone to even step foot into the store would have to show their ID and be 21 to get in. So that's in summary of the regulation, but it is in the draft, that definition of adult-only retail tobacco store.
Okay. But
know-
if we decided to in our if this truly is going to impact, we don't have adult only, but we have stores that sell these things. If we were to say, okay, you could sell them to adults, you could sell them to so we're saying 21 is the age for
Yeah.
anyone to sell. So we're not talking, but the new draft regulations are to lower that age. Is that what I'm hearing?
Nope. So and Meredith or Lisa, correct me if I'm wrong, but the state laws are what restrict the age to buy those to 21. So we would just be restricting where they can be sold.
Okay.
So we would be saying they can only be sold in an adult-only establishment where you have to be 21 to get in. So that would mean the gas stations, liquor stores, and everywhere in town, anyone that, I don't know how many of our establishments actually do sell these. But they wouldn't be able to sell them because they're not an adult-only retail tobacco store.
And so we can't be ingenious and put that regulation on a not an adult only store. Is that so? This really, what I'm saying is we can't have pouches, and I know that the evidence is out there that they don't, because I heard the original thing that they don't help with smoking cessation, but these people are over 21. And we're not taking cigarettes from people who are over 21, and we all know that those are dangerous for your health. But if we should decide we want that's the only people these can be sold to, do we have the right or the state backing or the interest to do that in our everybody comes and can get whatever they want to except cigarette and liquor? That's what I'm asking. I understand we don't have an adult only. We got nothing
Yeah.
like that. So we can't impact sales in our service stations. Is that a correct statement?
Yeah, I think so.
So it's all or none.
It's
is
already at 21 to buy those. So
Okay.
So I don't know if any towns have, I guess maybe we theoretically we could make the age higher, but I don't know that we would want to do that.
No, it's already
Also-
21 is what I'm
Yeah.
trying to say is if we're being excluded, so we're now going to bar it for everybody because we don't have an adult only. What I'm saying is if the concern among some is that adults, if adults are going to, if adults want to get that, they should be able to get it. But how can we protect youth in that situation is what I'm saying. How can we balance both?
Well,
Because
how do you protect the youth from
yeah,
getting cigarettes? It's the same way. I mean,
because
there's a law.
we don't sell cigarettes to under 21, right?
So then we wouldn't sell nicotine patches till under 21.
Yeah, so as you can see, we got a lot to talk about.
Yeah.
I can't see banning nicotine pouches for adults.
No, that's not what I'm saying. I just want to know what the options are. I don't really, that's not, I was concerned with the reasoning for this is to keep it out of the youth's hands. So I was seeing how we could do that without.
Yeah.
So.
Yeah.
I'm taking up all the conversation and did I override? I thought I heard you say something. Did I speak over you?
No.
Okay.
Yeah,
No.
Is it okay if I chime in a little bit, or is this not public comment?
Well, it's not public comment, but go ahead and.
Sure.
And you want to introduce yourself?
Absolutely. My name's Jeff Smith. I am a senior fellow on harm reduction at the R Street Institute, which is a think tank in DC, but I live in North Carolina.
We got your correspondence.
Yep. And so when I read the regulations, there was a couple of things that really popped up as a concern because it feels like there's a lot of pressure being put on local towns and cities to kind of adopt things that may not fit their particular way of living. When I heard you guys don't even have adult only stores, if you were to include the nicotine pouches in the regulation, then the adult smokers and adults that want to use these products wouldn't be able to purchase them, right? And my training is as a neuroscientist, and so my focus is really understanding what drives smoking behavior and what are alternatives for individuals that want to move to safer, less risky products that contain nicotine. And there's just a tremendous amount of research now showing that these nicotine pouches have carry the same risk as nicotine gum or nicotine patches, which the FDA has approved for cessation. And so to not have them in the gas station right next to the cigarettes, you already can't put vapor ends products next to them. You're really limiting options for smokers who stop into the gas station to fill up the car, grab a soda and a Snickers, and then see the pack of cigarettes and think, well, I really want to smoke right now, but I don't have any other choices because there's nothing else behind the register other than cigarettes. And so, the reality of it is that these pouches have gotten a lot of bad press, but they're a really useful tool to smokers that are in the process of quitting cigarettes, to give them something where that will still give them the nicotine without the carcinogens that come along with the smoke. So there is a tremendous amount of research growing in this space. There's also a lot of bad press because Zyn is a popular brand. It's all over social media. But what you guys have done is allow for, the retailers to be responsible retailers, card the people that come in to buy these products and make sure that they don't get into the hands of kids, but allow them to get into the hands of adults. And that's really what we're concerned about. We want to move people away from cigarettes to get them into products that dramatically decrease the risk of short and long-term health and death. And if we don't allow these products to be in place where they can easily get to it, it's just so easy to go back to buying a cigarette. And that's our concern. We want to make sure you guys have as much information as you need, or any questions that you might have, just to allow for your consumers to be your citizens in your town to have the options available to them.
Okay, Terry or Trish, do you have anything?
Yes,
you wanna add?
I'm just interested in the information he could provide, Jeff,
Sure.
with studies or whatnot that you've mentioned. Could you provide those to us so we can take a look at them?
Absolutely.
Um,
And I think if you look at the references in the letter I sent, there was a really good article specifically about the benefits associated with nicotine pouches, in terms of even comparing it to dip and other less risky products, as them being on the same level as. But I'll put some papers together and send them to you. Who should I send them to in particular? Is there any one of you guys?
You can, I think you've already sent an email to me. You can send
Okay,
it
we'll just
to
send the same
Tom
one.
Hibbert, and I'll pass it on to the board.
Okay, cool. And I'll be here next week too. And so, in any time in the interim, if you guys have any questions, because the science is crazy, because it's a relatively new product. The legislative side of things at the federal level is really noisy as well, because you can't really, you guys mentioned that none of these products have been approved by the FDA, CTP, the Center for Tobacco Products, which is absolutely true. But they've been sitting in the inbox at CTP for 3 years now. And it's just because the CTP has been so overwhelmed, they haven't been able to get through all the vapor products to then start looking and evaluating the oral products, the new oral products. But they're promising that's going to happen sometime in the next year or two.
So, we're talking about nicotine pouches. Have cigarettes been approved by the CDC and FDA?
Well,
We're referring to getting approved as a tobacco cessation product.
Well, no, I think we're actually talking about the same thing. It's a consumer product. It's not going through the group at FDA called CDER that evaluates drugs and treatments. These are just consumer product approvals. And yes, the CTP is approving cigarettes every day, because the pathway to get into the market for a cigarette is so much easier than it is for new products, because there's this process called substantial equivalence, which basically shows all the tobacco companies have to do is show that their new product is the same as the product before the Tobacco Protection Act went on the market. If they could just show that they're the same, then they could put that new product into the marketplace. So it was extremely easy for tobacco companies to get cigarettes on the market and keep them on the market. What's really hard is that when you have a new product, you have to go through this pathway called the PMTA pathway, pre-market tobacco authorization. And since you can't compare it to anything, you send in these huge applications. The FDA said that they had something like 25 million applications that they've been going through for the last 3 years, trying to get through them all. And those are the products that have been approved. There's a couple of products from Reynolds and Altria and PMI that have been approved as vapor products or heated tobacco products.
Okay, let me, Erica, you want to say something?
Just to get some real-time perspective. I work in the middle of Springfield at a low-income primary clinic. And a lot of my patients have actually been asking about these pouches. The nicotine replacement products that are actually approved by the FDA, whether it be the patch, the gum, or the lozenge, they're not inexpensive, and a lot of insurances do not cover them, even if they're written as a prescription. So expense could be a really big component for a lot of people.
Okay, Terry, Tricia, do you have any more you want to ask or say or add?
Nope, a lot of information to consider.
I agree.
No, I'm not sure whether we have to make some kind of decision.
Meredith raised her hand.
Oh, Meredith, you have something to say?
Yeah, thank you so much, Madam Chair. Yeah, I'm all about, adult smokers transitioning however they have to quit the use of tobacco and nicotine eventually. I just want to add a few points here. It's at the question after that, though, is at what cost? Because what we saw this happen with electronic nicotine delivery devices. They originally were being touted like in the 70s and 80s as a cessation product, not approved by the FDA, and to help people quit from traditional combustible cigarettes. And then all of a sudden, we started seeing in, the 2010 youth use of traditional cigarettes going down, down, down. And then all of a sudden in 2016, 17, there's explosion of these electronic nicotine delivery devices on the market and marketing towards youth. And we now have this whole new cohort of nicotine users being our youth. And that's what I'm here for. I'm now wearing my public health hat because I've been working in the public health landscape for over 2 decades now. I just really, when we talk about tobacco regulations, it's not about the adult user that we're really concerned about. It's about not creating a whole nother generation of tobacco and nicotine users. So I just wanted to put that out there. And a good plug for the 1-800-QUIT-NOW line is you can get tobacco cessation products. They do give you free patches. So there is some affordability products out there. Okay, thank you so much for allowing me to speak.
She brings up a great
no.
point, but again, just to make sure that we're clear, the primary reason why we saw the increase in youth use was companies like Juul that didn't know what they were doing, advertising directly to kids. But since then, in 2019, Tobacco 21 passed. And now, before 2019, it was easy for kids to walk into the gas stations and buy these things. Now, the responsible retailers are going to card anybody that looks like they're under the age of 30 and ensure that these kids aren't able to buy the products at point of sale.
All right,
So
thank you, John. I gotta move on here. So
Absolutely. Thank you, guys.
if we're gonna have a hearing next week, do we have to agree what we're gonna put into our draft to present it for the hearing? No,
I'm not sure.
I mean, so should we make some decision whether
Yeah.
we're going to restrict them or not restrict them in order to present at our hearing?
Meredith, Lisa, what do you think on that?
So I think you should include it in your draft, and then at the hearing, after you've heard public comment and you've had an opportunity for a board discussion, then you propose the vote. Someone make a motion whether they want to approve that portion of the draft or not. Lisa probably can give you a little better advice, but
Yeah, so I agree with what Meredith said. If you want it to be part of the conversation during the public hearing, your best step forward, your kind of the best practice is to include it in the draft. Yeah, so that would be my recommendation. And then the public will have a chance to weigh in on whether or not they would like to adopt this. I also just really quickly want to add that in terms of the cessation device, that the nicotine content in these pouches we're seeing is getting higher and higher. So when you talk about cessation, the alternative to that, or the kind of counter to that, is that really cheap, very high nicotine content products are going to increase the likelihood of people getting addicted. And that is where the concern from this comes about. And again, these are not approved cessation devices. So
Okay,
thank you.
so I think Trish and Terry, we can make some decision now whether we want to include that in our draft or not include it in the draft. My opinion is that you have to be 21 years or older to buy cigarettes. You have to be 21 years or older to buy nicotine pouches. We don't ban cigarettes. We shouldn't ban nicotine pouches.
Can I just bring up 2 points? So just 2 things I wanted to clarify. One is regarding the access, and I understand the cost may come into play, but if anyone actually is trying to quit smoking, we do have 2 pharmacies in town, and approved cessation products are available at pharmacies. That's correct, Meredith and Lisa? Yes. And so there is some access. There could still be issues with that regarding the cost or whatever. And then also regarding, having responsible stores, in a perfect world, no one would make sales to under 21. But in our compliance checks, we have had 4 sales this year. We went years without having any sales to minors, but just during the compliance checks, there's been 4 sales this year that we've actually caught them selling to minors. So we don't know how many other sales there are for actual kids that are just trying to go in and buy cigarettes or nicotine pouches or any other age-restricted tobacco products. So just wanted to bring up those 2 points.
The other option is, why don't we just go by the state regulations and not have our own regulations?
What's that?
Okay, with our food regulations, we just said, forget it, we're going with the state.
Yeah.
Why don't we just go with the states? I mean, they're not as detailed.
If the state regulations don't have anything about licensing, so then it would be a total free for all, and they wouldn't need a local license to sell tobacco. So I don't think that would be wise.
No. Okay, anyways, that was my opinion about the nicotine pouches, about not restricting them. Trish and Terry, what do you think?
This is a lot of material to kind of digest tonight. I mean, from a healthcare perspective, a healthcare person, and again, I told you about my background, it's tough to think of access for kids. But also on the other hand, coming from a family of smokers who have tried, various things to quit, it's also tough from that standpoint too. And it seems to be, either at this point an all or none. We bar it for all the way the regulations or the way the state definition is, or if we were to come up with something different, I don't know that we could craft something between now and the hearing next week. And that's my opinion. My opinion is I have mixed. I need to digest some of the information and some of the comments that we've had, because they've on both sides, they're very compelling arguments.
How about you, Trish?
I agree with Hannah. I do have the same concerns with access the youth will have to it. So I would like to review stuff just like her and take a look at those studies too and just see the whole picture.
And I think out of fairness, when we do a public hearing, we tailor the information piece in much the same way that the town meeting is, so that we have information, that defines just what the pouches are and the pros and the cons. That would be and I would like to have some kind of document that shows me the pros and the cons as well.
Jeffrey, are you still on?
Yes, ma'am.
Can you send something to Tom about the pros?
I will put a package of information together
Okay. And Meredith, can you put something together, or Lisa, about the cons and send that to Tom?
And Meredith and Lisa, I'd love to look at see what trend, if you have trends. I'd love to see some data from both Jeffrey and for you that shows the trending both from a benefit side and a let's keep it out of the hands of kids side.
Mm-hmm.
Okay, so in the meantime, how do we handle this?
So, so it sounds like the three of you are kind of on the fence about it. So, I guess there's the option, you could vote right now to put it into the draft and we can consider it for next week. Or if you wanted even more time than that, you could just table it for now and we could revisit it. We have to go through the whole hearing process and do all that again, but we could do that at a later
hearing.
No, table the nicotine pouches. I think kind of if we want to get it all done, one way or another, I think the best thing to do would be to, put it into the draft. And then we can hear, anyone can send us your statements. We have the public hearing, and then at the end of the hearing, we would go into the meeting and then the board would deliberate, and you could accept the draft as a whole as written or accept the draft and remove that part of it.
Do we need to vote or whatever to put it in?
I think probably that would be a good idea.
No,
And that's not a vote to decide that this is going to be the adopted regulation. That's next week. It'd just be, this is the current proposed draft that could still be modified.
And the only pushback I might have is that it comes out as being the opinion of the board. If we're putting something in a draft regulation, that it looks like all three of us are saying, yep, we're okay with that. And I think I would have to abstain. I don't feel comfortable right now voting on that because I'm not sure.
Okay. Just to clarify, I don't think that would be saying that's the opinion of the board. I think that would just be kind of the openness of the board. This is something that we're considering, and that's why we're having a public hearing, is we want to hear what the public has to say, and it may or may not be modified. So I don't think, if you're still not comfortable with it, then, I'm not trying to change anyone's mind, but I don't think, putting it in the draft, I don't think is necessarily, an indication of the board is going to do this. You don't have a say in it. That's why we're having the public hearing, is because people do have a say.
All right, the other thing is to just postpone the public hearing, not have it, postpone the public hearing. This isn't something that really has to take affect like the fees before the end of the year.
Right.
I mean, if we can, in my opinion, and Trish, don't let me speak for you or Sue, if we were able to present it to make sure that the public who comes knows that this is, we're putting it out here, this is what, towns are beginning to put in legislation, and we have, and I would again like some info to be able to share at that, like we would at a town meeting, so people can give opinions one way or the other. I would be comfortable with that if it can be presented as, okay, this is, we're throwing this out there, and I mean in a better, more articulate way than that, to get your opinion.
I don't know what to say.
Pardon?
I don't know what to say. I don't know how to,
Yeah, I
don't.
That's what I'm saying. It's not an easy, and I think it's a statement that both Meredith and Lisa and Jeff have put forth good information, and Tom as well for doing his homework.
Meredith, you have something you want to add?
Sure, absolutely. If I can add just my, a little guidance here. What I would recommend to my Board of Health if I was wearing my Northampton director's hat is let's not let this one strategy hold up the rest of the regulation. I would say exclude it from the regulation right now. Put the draft regulation forward for the hearing next week, vote on that, and then you can have robust discussions around this one strategy. After the fact, you can amend the regulation, just as easy after you pass all the good work that you've put into this one.
Yeah. I think that's good advice. Thank you.
You're welcome.
Do you agree with that, Terry and Trish?
Yes.
Yes.
Okay.
During the hearing, though, would we bring up the nicotine pouches?
No,
Just-
I think in that case, we would not. We would say it's not in the draft,
Okay,
and that's that.
so nicotine pouches would be allowed until we
Yeah,
decide
and
otherwise.
then future meetings, we can continue the conversation, and if we get to a point where the board is in agreement that yes, we want to do this, then at that point we could propose a draft, call a public hearing, go through the process again.
Okay,
So
so
if that's not changing, then I guess we should discuss the shall versus may.
on page 10, under the violations, we have may be suspended for 7 days. The other one says may be suspended for 10 days. It's under 1, B, and C. The recommendation was to change may to shall, so that there's no,
Room for interpretation.
yeah. Or do we want to have room for interpretation?
Mhm. I think that's where we get into trouble when and I think that's why when we did our liquor, underage liquor, we set the example. My vote would be to adopt the shall.
Trish, what's your thought?
Adapt the shall.
Okay.
So I don't know, do we need to vote on that because we're not voting on?
Yeah,
the-
just someone make a motion to amend the draft. And then I'll update that on the website and we won't put in the nicotine. Also, just for clarification purposes, we might as well take out the definition for unless you think it's worthy to keep it in, but if we're not banning oral nicotine pouches, just so people don't get confused, should we take out the definition of oral nicotine pouches?
I'm gonna let Lisa answer that one. I don't know if it matters either way.
Did this
Okay.
get added because it's a different,
I would remove it. There's no
Remove it.
need to have the definition
Okay,
issue. There's no related regulation.
Okay, thank you.
May I also add one more thing?
Sure.
And I reviewed your regulation again before the meeting, Tom, and I don't think we caught this when we spoke a couple weeks ago. The violation section, your local violations, 2, B and C also have the word may and not shall. So if you're,
Okay.
yeah, you might want to consider changing those as well.
Okay,
What page is that on, Meredith?
that's also on page 10,
Yeah.
Also on
on
page
section,
10.
just section 2.
I so move that we change the mays to shalls in the areas that we discussed.
I'll second that. All in favor?
Terry Putnam, yes.
Trish Liveniak, yes.
Sue Braska, yes.
And might I also add, Tom, I think, you know, sometimes when we say we may go forward at some point in time and address this, I would keep this as a parking lot or as an agenda item, because I think it is important enough to keep on the burner. I don't think it's something that we just let lie.
Okay, I will add that into our next agenda. Well, not for the hearing, but for the one after
Yeah,
that.
yeah.
So Tom, you have the Word document, right? And you're gonna
Yeah, so
change,
I'll amend those and I will,
take out oral nicotine.
I'll try to get that posted on the website, updated tomorrow. Perfect. Thank you. So, before we talk about the fee schedule,
Are we all done with this? Are we all done with the tobacco to move on? So I want to thank Meredith.
well, I was just gonna say we jump ahead because while Meredith's here, I just want to tell you guys we had another sale
Okay,
since our last meeting,
Right.
so if,
so Jeff, are you still on? And,
Yes, ma'am, I'm still
Yep.
here.
they're
Okay.
still also on.
so I wanted to thank you too for your helping us and
Thank you, guys. And like I said, I'll get
Good meeting.
the documents to you. And again, always around for questions if you guys want clarification. And I'll
Okay.
log in next week as well, just in case that there's conversations that take place during the public hearing as well.
all right, thank you.
Awesome.
Thanks.
Thank you,
Thank you.
guys. Y'all have a good night.
Thank you, you too.
Okay, so go ahead.
Thank
So,
you.
Meredith, if you guys want to, I'll jump ahead to, we just had a, sale to a minor on November 23rd at the Pride Station. So I brought them
September.
there. What's that?
September,
What did I say? Did I
November.
say December? November? Oh,
That's
wow.
okay. I just hope that wasn't written. That's
No,
fine.
no, it wasn't.
Okay.
It was September,
Okay.
the ninth month of the year. So there was a sale. I brought them their violation notice on the first, that I personally hand delivered it to them. So they have 7 days to request a hearing. They have not yet.
Did you deliver to the manager? Or
Yeah, I brought it to the manager and then I also scanned the copy the next day and emailed it to their main office
office.
that we had on file just to make sure they got it as well. So they have 21 days from the first, so they have till the 22nd to pay the fine. And if they don't request a hearing, I will just coordinate the timing of their 3-day suspension with them. And
Now, do we wait till they pay it and then coordinate the suspension or?
I think just once the 7 days are up and we know they're not gonna request a hearing, then I'll coordinate with them.
Okay,
And then that way too, I can remind them, you have so much time to pay it. If you don't pay it, you're gonna have much larger problems. So I don't think there's much discussion for that, but I just wanted to report that to you and
you know what do we have if they don't pay it? What do we have for?
I think we could call them into a hearing and we could
They
take
pull their
their license. I think it would be an additional violation that they didn't pay, so we
Yes,
could
yeah,
fine them
that's
even
right, the
more.
Suspension.
So, but
Oh, wow, that's inspections.
Yeah, I
There's
think
no
both,
failure to cooperate or interference with inspections.
yeah, I
But
think
that's-
most likely if they didn't pay, we would call them in for a hearing and consider pulling their license. But so we've gone, I don't remember off the top of my head, but it's been years since we've had a sale. And we've had 2 in March, 1 in June, and 1 in September. So I don't know what's going on with all of our vendors.
Can I ask a question?
yeah.
Meredith, did we have, compliance checks in 2023 and in 2022?
Yep.
And we had no sales.
You had sales, let me see. Nope, not in 23. Nope. No, historically, I'm going all the way back to 2017 when I took over as the coordinator. No sales on record that I can find.
Yeah, wow,
Yeah. So yeah, I don't know
what's going on?
what's going on. I know Cliff Clark from the newspaper was asking me about the regulations and the sale. And he had seen on the previous agendas that we had other sales, so I don't know if he'll do a story and any of the stores that don't know that you first sale is $1,000 fine and a 3-day suspension, maybe they'll find out that way and start up in their game a little bit. I'm not sure, but it is a little bizarre to me that they were so good for so long and then to have 4 in 1 year. But I guess hopefully they'll learn the hard way, these ones.
Okay, so now we're just waiting on that.
Yeah, so no vote on that, but that's all, that's the only other tobacco thing we have, so thank you, Meredith and Lisa.
And if
Yes,
there
thank
is
you
an
very much.
appeal, yeah, just let me know and I'll have the tobacco compliance officer, if they're available, attend the hearing. If not,
Okay.
we'll get written testimony from them and I'll probably attend the hearing as well, just to provide any guidance if you need it.
All right, thank you so much.
Board. Yep, thank you, Tom.
We're gonna see you next week?
Yes,
Okay. All right, good, thank you.
thank you. All right, have a great night.
You too.
Okay, for the fee schedule. The only thing that I had the question on was that under 25, remember it was about the refrigeration. So Terry and Trish were looking at the fee schedule.
Okay.
And the changes according to our last meeting. But I did have a question on the food display under 25 square feet, non-refrigerated food items. I was listening to our recorded meeting, but I forgot, I didn't really know how to word that. So I just put under 25 square feet, but not requiring refrigeration. How about if soda is refrigerated?
Nope. That wouldn't apply.
'Cause
Like
it
if it's
doesn't spoil.
something that needs to be refrigerated for food safety.
Okay, so how do we word that under 25 square feet?
Just call it like
Says food.
small. I mean, it would be in the food code that if they have prepackaged food,
Yes, how do they define it? Do they have one term for it?
yeah. I don't know. I think under 25 square feet would be fine. Yeah,
Under 25 square feet requiring a
yeah. I mean, it's like,
permit?
I don't even know if anyone falls into that category right
Well, how
now,
about,
but like if I don't know if any of the
Tractor
liquors,
Supply has,
well, they just have soda. I don't think they have a license because they just do soda and
and they might
candy.
have some candy.
So
okay.
they don't need a license, but like,
Mostly it's that.
you know, say a liquor store, you know, they have one refrigerated case and maybe they have, milk and
So milk they would,
milk and eggs.
but they would.
They would need but if everything else in the store is either candy,
Chips.
cigarettes, chips, or alcohol, they don't need a food license for any of that, but if they had one small refrigerated case.
So I guess we just leave it like that and then,
Or we could-
and then when the time comes, you just
Yeah,
see what they have.
yeah,
So some people won't have to get a permit.
yeah.
All right, and did we really want the mobile food unit to go up to 100 to double?
Yes,
Okay,
those
what-
are a lot of work.
okay, what about the people that have multiple?
Multiple
food units.
food units, I mean, they are supposed to get they're supposed to get a license for each one.
But do we get some kind of,
Like, I mean, the only one I know of that has multiples,
malicious,
actually, I think Bear's Barbecue, although some of them don't have multiples, but there's only one that they bring to Southwick. And the Butcher Block in Westfield, they have multiple units. But like a lot of, like with Joe, from Malicious, I think he has only one that he gets annual permit for. And the other ones, he just does a temporary. Cause he really only does, the
mobile, on the
motocross.
Okay,
So he'll get temporaries, he'll get like 6 temporaries for the motocross, cause he has like 6 different tents. But then I think he only has one truck, that he actually gets the full mobile
Okay.
permit for.
all right.
Um,
So it is, we'll leave it 150 and the other
Yeah.
one, we'll just say under 25 square feet.
yeah, I mean, you could do a bulk. Could do a bulk discount of like, 150 for the first one, and if you have multiple units. I mean, the difficult part with the mobile food units isn't the inspection itself, it's scheduling it, coordinating them coming here. Brian from the fire department comes. So, you could say if someone has multiple units, and they were able to coordinate inspections on the same day, 150 for the first one and 75 for the second, or just leave it 150. It is a good amount. Those ones are a good amount of work to get them all scheduled and everything.
I'm okay with that.
This seasonal food permit. That can be a mobile food unit too, couldn't it? And
I think so.
Temporary.
Yeah, I think so. Cause some of seasonal, I think Malicious, the actual store, the brick and mortar, I think that could be a seasonal. Because I'd have to look, I don't remember if he is or not. But there's not many, other than that, most places are open year round. But then we had a seasonal, the ice cream, Northside Creamery in Westfield. They did the ice cream events at the car shows at the Daily Grind. They did like every Monday night for the summer. They got a seasonal for that. So I think seasonal could be like a brick and mortar,
Or it could be a.
or it could be a mobile.
Okay. Trish or Terry, anything you wanna add or question?
So where are we seeing seasonal? I'm sorry, I'm not following that.
Top line, the top.
The very top line.
Okay. Well, but isn't Joe open for half of the year at least?
I'd have to look at his license. I don't remember what his exact
I think
schedule is.
Yeah,
He
I
actually
think-
he might have a regular license, not the seasonal one for
Yeah,
his.
no, I think he's open except for maybe 2 or 3 months, but I could be wrong because Jim likes a
Yeah.
lot of ice cream, so.
Oh.
So he goes around there. And the only other thing I need refreshing on is what's the difference between minor tobacco fines and major tobacco fines at the very bottom?
So those would be,
If you're missing a sign, some
Yeah.
signage.
Oh, okay,
so the major ones would be the violations to the state law, the sale
Okay.
to the minor. And then the minor ones are the things that are just in our local regulation that are, you know, you don't have the sign up or
You didn't,
something like
you didn't
that.
train your employee or,
okay,
Yeah,
yeah.
got it.
and,
And the well fines will. we
I
gotta
think the
fix
well
those.
fines we can take out.
Well, no, because they're in the
They're-
regulation.
Oh, right,
And we
okay.
looked them up and they're actually in the regulation until you
Yeah.
revise the well.
Yeah, that's our
The well
next,
rigs.
that might be our next one.
In your spare time.
Yeah, exactly.
So next week, Trish or Terry, who will be able to come in person?
I'm in person next week.
Oh, good.
Trish, are you in person or Zoom?
Nope, I'll be, because I drive out to Worcester, so I'm out in Worcester. I-
Oh,
Yeah, so I actually stay here when I'm here on Thursday.
okay,
Yeah,
all right.
Okay.
And it should be pretty straightforward since we're not including the nicotine pouches. Seems
Yeah.
like that's the controversial one.
Yeah, it's, that's what all the calls I got. There was, I think, a few different phone calls and then the 2 letters. And they were all specific to the nicotine pouches, so hopefully it will go fairly smoothly since we tabled that.
And the hearing is basically to let the public.
Yeah.
Express their.
Yeah.
It's not really like a question and answer thing, right? It's, okay.
And it's
Um,
possible, I would think it might be possible that we get some questions. If it's out there about the nicotine pouches, we may get some questions from that. So that's why I appreciate getting some literature or getting some
Right.
data and information on that.
Right. I have a couple clarifications for the fee schedule.
Okay,
For disposal system, we have the disposal system construction permit and emergency repair. I would prefer to call it the disposal system construction permit. And the disposal system construction permit, and then just say component replacement only. Instead of emergency
Okay, so
repair.
disposal system construction. Component replacement.
Yeah. And then on the bathing beach permit, since we say no charge. I'd like to say, call it the town bathing beach. Because if I feel like at
That's
this,
right,
at this
okay.
point, it's probably pretty unlikely that someone has enough beachfront land that they'd like to open a public bathing beach that's not their own private property for their own personal use. But if that did happen, we would want to charge them for that fee. But since it's the town, we don't
Okay.
charge, so.
I'll fix that.
And I think that's all. That's all I had.
All right, so you're gonna I'll fix this and you're gonna fix the draft.
Yep.
All right. Okay, can we move on?
Think so?
Okay, FOG regs, those are on hold.
Yep.
Okay, sale to minor, you've talked about,
Yep.
so now you report your septic.
Yep. So septic, 77 Tannery Road was. I'm trying to refresh my memory on that one. Yeah, that was a repair.
Okay, what's, that land on Tannery Road on the right? Is
When you're
Vicky's
going
land,
into Southwick or into Westfield?
going into Westfield.
Into Westfield. I don't know what that is. I think there were trying to do perks there years ago. I don't know what the status is of it.
Used to be some kind of health club or.
Yeah, that's what I had heard. Yeah,
So you haven't done any. perks
nothing
there?
recent.
No.
Nothing. We did across the street, a little diagonal there, is a lot that I did a witness to perk last year. And they were. What's that side street there?
There's a Salem, there's a.
Yeah, it's
right.
the homeowner had a house on the side street,
Mhm.
but his land also had frontage on Tannery.
Okay,
So he did a perks and I think he's in planning now. And he's trying to cut off that lot and sell it as a building lot, so. But that's the one you're talking about is on the other side of the street. And so approve some plans. All repairs, those 51 North Lake, 371 R, North Loomis, and 134 Feeding Hills Road.
371R, what is that?
That was
Is
a,
it here?
yeah, it's a
there?
house, yeah, it's,
And
was
that's their
part of the
address?
old Kellogg
And that's-
estate.
and that's their
That's the
address?
address, yeah, there's one in the front,
And
there's
this
a-
is the rear?
yeah, there's a front lot and a rear lot. But it's a few past the Kellogg's concrete, and at one point, I think all those houses were Kellogg family. I think that one is still owned by the Kellogg's.
Okay.
Final inspections, 10 Field Street, the repair, 17 Silvergrass was new construction, 134 Feeding Hills, 279 Long Yard, 24 Fred Jackson, 23, those were all repairs, 23 Noble Steed was new construction, and 2 Saddle Mountain Road was new construction. Housing has been a busy month, it's picked up a little bit, so, 4 of them, 2 of them I had already told you guys about, they had started in June, May, maybe. But two more complaints at the Southwick Villages, formerly the American Inn.
And we have a copy in our folders of,
Yeah, 2 of the letters I sent.
does Trish and
Yep,
Terry have a copy of them?
they should have them, yeah.
Okay,
So 5 South Village East, that one, I don't think I included anything, that was pretty straightforward, the tenant had complained about. Her primary complaint was the AC wasn't working. And it happened to be that when I showed up to do the inspection, the South Village was just waiting on parts, and the repair company was there that day. So she had a couple questions about other things, but nothing was major. She was happy, so I just documented it and sent the letter to the to South Village. I sent a copy to her. So that was pretty straightforward and simple. 15 South Village, that was an interesting one. The occupant had moved in a few months earlier, and it was a 2-bed. I did a letter on that one that I included to you guys. There was a odor in one of the bedrooms. It was a sweet smelling odor, and the occupants found it extremely offensive. I went there with the fire department. He brought Brian from the fire department brought his gas detector. So there was no gas leak, no coolant leak or anything. They had an HVAC company out to make sure the AC system was not leaking.
and you smelled it.
I did smell it. I thought it was actually somewhat pleasant, or at least neutral. It could have been the thing. Before these people moved in, they had redone the floors throughout the whole apartment. So it was a mix of new carpets and new like vinyl, that like faux wood flooring that's really popular these days. So it could have been the glue or the laminate. That would have been my thought, but they redid the floors in the whole unit, the same 2 different types of floors, and you could only smell it in this one room. So I had advised the people, they had it all sealed up, windows shut, the door shut, they had a towel at the bottom of the door. So I said, if you don't want it coming back into the rest of the place, keep the towel, but at least open your windows, run the bath fan, get that, whatever it is, out of there. And there was nothing I found that would have constituted a violation of any sort. So I even reached out to DPH, and I think I detailed that all in my letter, but
And then they thought it was the AC thing?
yeah, then they thought it was the AC thing, so I had suggested that, and Southwick Village, to give them credit, they actually contacted me before the tenants contacted me. They said, we've had this tenant complain, we've tried this and that, and we don't know what it is. So they contacted me, and the next day the tenants came in to complain. So So I don't think it was lack of action. I think it, it could have been a spilled, some sort of cleaning product or something like that.
So is the smell dissipated now?
I don't know.
Okay.
I don't
haven't
know.
heard.
So no, I haven't heard back. So
Okay.
I told him, I basically eliminated the possibility of water, anything that would constitute a violation of the code. A water leak or something, there was nothing else that it could have been that would have been a violation. So, so I sent them their letter. I haven't heard since. I know,
So that was 15
Yeah.
South Village?
yeah, 15 South Village. And then 25 South Village and 32 Sawmill Park, those were ones that had been ongoing. And then everything had been completed. One of them, the tenant was moving, so they just waited till she was gone, and they had a light fixture to replace. And the other one was a moth infestation, but it was not, I don't think it was totally an infestation actually, but they sent me their reports from the exterminator, and even though I didn't document it as a violation, they sealed up. There were some cracks along like the 3-season porch. So they had foamed that up wherever the cracks were. So they kind of went above and beyond on that one. So,
And Samantha, I think, included that in the last minutes too.
oh, yeah, yeah. So those 4, finally all done. There's no open violations at, Southwick
So they're
Villages.
completed.
Yeah. 8 Curtis Road, that's an interesting one. The former owner, had come in and said he wanted to clean it up, and it was in bad shape. There's still some people living there. And he suggested that it should be condemned.
So,
It was foreclosed. So as of last December, he doesn't own it.
so is it the inside or the outside? What's?
Both. It's not in good shape, but I looked it up. It was foreclosed last December. And I looked up the court records, and the bank, which took ownership of it, I think they were granted the eviction, but it hasn't been finalized yet. So there are a few people living there.
And the bank owns
The
it.
bank owns it, and they are on the final stages of the eviction process.
Okay.
So they're just basically awaiting a date that, as far as I can tell from looking at the court records, awaiting a date that they will set, and they will go with the sheriffs and kick anybody out that's still there and change the locks. And then the bank will clean it up. And they probably won't fix it up to be livable, but they'll, clean it up and then probably auction it off is usually what they'll do. So, so even though that former owner, I don't know why he would have wanted anything to do with it since he didn't own it anymore. I don't know if he thought maybe he'd be able to get it back or something, but he had wanted me to condemn it, but being that it's,
Mhm.
weeks away from them being evicted, I don't think that's necessary.
Okay, Aaron Circle.
Aaron Circle, this one we've talked about before. In the spring, the laundry, I had went out there and it was hot. And then the occupant had called me again, said it still wasn't hot. So I, instead of going through her, the occupant, because the laundry is in the community center, and I wanted to be able to access the mechanical room. So I just contacted the property manager and set an appointment with them. I looked in the mechanical room. We ran a load of the wash. The water was hot. I tested with the infrared thermometer, I tested the outside of the valve, and the metal was 120 degrees. So, which the range is 110 to 130. Just for hot water. There's nothing specific to laundry of what the temperature needs
Anyone
to
else
be.
complain?
No one else complained, and the way each building, there's I think 5 or 6 buildings there. Each building has its own mechanical system, hot water system, and there are 2 huge, taller than me I would guess each tank is at least 100 gallons, the hot water storage tanks. And those tanks serve the whole, not just the laundry machine, they serve the whole building.
It's not that big,
100
gallons.
well, there are two of them that were
There's two.
like this big around and taller than me, so they might even be more than 100. I didn't measure them, but
Right.
and so no one, so it's in addition to serving this laundry, then the sink in the community area, there's at least 4 or 5 other apartments that are served by that same water heater. No one has complained that they don't have hot water, so the tenant says that it's not hot the whole cycle. I think that is modern washing machines are energy efficient, so if you do hot cycle, it's not pure hot water. But as far as I could tell, the way the code's written, it needs to be connected to hot water, it needs to be working, and it was. So that wasn't a violation really, and it was the right temperature, so so I did document that. I didn't include it. I just sent the letter, but I also have the inspection report. If you wanted to look at it, I could send it to any of you. She did call, she was unhappy. And I was in the process of telling her that, that you can complain to the state, you can complain to my board. And she hung up on me before I was able to finish telling her where to complain, so.
Did she measure with a thermometer?
I don't think so.
Okay.
I don't think so. So, yeah, so for whatever that's worth, based on everything I can tell, I don't see how that could possibly be a violation. And we'll see if I hear from her again, but
Okay, 80 bungalows.
80 bungalows, so there's good. They haven't made much progress on the outside, but I have talked to Highland Valley. And they have made a lot of progress with indoors with her finances and everything. They have her hooked up with a new agency, I guess, out of Springfield, that when people are at risk of losing their homes to foreclosure, it's called No One Leaves. And they help people out with, finances, getting things fixed and that sort of thing. So I talked to someone from that agency yesterday. And they have, she has her finances in order, and because she had been scammed. So that was kind of what got her down this road, was not getting her Social Security payments. So that's kind of back in order.
So she's going to have heat.
Yeah.
And she has water.
Yep, she has water, and that should all be, and Highland Valley is still involved.
Okay.
So that I would have liked to see more like on the ground progress, but there's kind of behind the scenes stuff going on, and I'm hopeful that it will be.
So the only violations really now are on the outside.
That, and then there's still some of the water damage in the basement,
Okay.
so.
Is the mold gone?
No, so it's in it's not her living area, it's in the basement, but that's something they'll be able to help her with as well.
Okay.
So, so that one, we're going on a year now that this one's been dragging on, so, I mean, there's been progress, but we'll see how that turns. They should have some stuff done by next month, so, if not, then maybe we can call her in for a hearing or something. And 6 Summer Street, that was the one of the 3 that got shut off for water bills, and that was the only one that was actually occupied.
That's one that tampered.
Yes, yeah, so they had turned it back on, and the water department shut it back off and put a big cement block over it, but they did pay what they owed, and the water department turned the water back on. So there were 2 others that were kind of they were kind of in the process of being rehabbed.
Okay.
And though I talked to both those owners, and they said, yeah, we're trying to fix the place up, and before, obviously, we're gonna pay the water bill before anyone moves in. So
Terry, do you have to leave?
I was just
Yes.
getting ready to say, yeah, I need to leave. I have to pop out for
All right.
another. So sorry, I don't get to hear the rest of the report, but if you'll fill me in if I miss anything earth shattering.
Okay,
Okay, if we have to vote on anything.
yeah, I don't think we do. I'm pretty
Just
close
food
to
service
done.
Inspections. All right, so
Yep.
we'll see you next week, at the hearing.
Okay. Thank
All right,
you.
thank you.
All right, thank you.
Bye-bye.
Bye.
See ya. So food, I did Tucker's and the 3 school inspections. All 4 were really good, no issues. Hampden County Health Coalition, we had a meeting today. Still kind of settling into we're not with PVPC anymore. We're with the FERC, the Franklin Regional Council of Governments
Mhm.
is our group. That's our fiduciary agent or whatever you call them. So that's going pretty well. They just do the meetings on Zoom, so I don't have to drive to Springfield anymore.
Good.
And Western Mass Public Health Association, I'm the president now. Which is fine. I didn't really want to, but it's not bad. That's a good group. So we're planning our annual Title V conference at the end of the month, on the 29th. That's kind of our big thing for the year that we do. And relevant systems, so that is the inspection software. I had another training for that the beginning of September. And I've been using it more with those housing inspections and the food inspections, and it's going well.
Any of the other towns using them yet?
I know
Country.
Granville is, Granville and Russell. And I haven't needed it in Montgomery yet. I think Blandford's still having a hard time getting it going, but other than that, I think everyone's
All right, good.
at least got it set up. And then Full Circle Technologies is our e-permitting. I met with them last week and they should have a beta version in the next, I think they said by around October 10th. So I'll have that to test out internally and make sure we like how it works. And then they said as long as we don't have any major issues, we could get that live by the end of October, which is just in time to send out our renewals. And they're gonna help me draft the letter that we would send out with the directions for everyone and how to do
We're gonna
it.
give them the option of using the e-permitting or
Yeah,
paper.
yeah, I think we can do that, so.
Mhm.
So one thing, I guess we could talk about it at I should have included that when we were talking about I just remembered it now. With the fee schedule, one thing that they said, you can do, a lot of towns do a discount. If you do the e-permitting, so like this is our fee. But if you do it on the e-permitting, it's, $5. That's how building does a surcharge. So, if you do a paper permit, it's $5 extra.
And and this is just the opposite, they're talking about a
Yeah,
discount.
so they said that's a better way to market it, I think is the term they used. So that's something we could talk about at the hearing next week too. And put in the fee schedule. So, but other than that, that should be pretty straightforward. I think I'm excited to get the beta version, start testing it out and making
Now,
sure
what
it's
do they mean beta version as opposed to alpha?
Yeah, so I think the alpha version is their first version that they just keep in-house. And then the beta, they like send it out to me and so it looks like the real site, but it's not live, it's only internal. So I can mess around with it, or Samantha could mess around with it and we could see how we would see the screen, how someone doing an application would see the screen, and then we have some time to test it, and if there's problems, we can make recommendations and they can change things before we send it out to kind of work out all the bugs. So that I'm hopeful that goes according to schedule, and then we don't have any major issues with,
So who'll have to be, you'll have to be trained on it, and Samantha,
yeah,
Karen.
Karen. And Karen already uses
Yeah, sure
a
uses it.
different, they're doing ours first. And then they're gonna update building, so building is using a previous version of the same software. So they'll update we'll get it of the new version, and then they're gonna work on building and updating theirs.
So do we still send out the application renewals forms? We still send all those out, right?
I don't think so, I don't think we would need to. Cause if we could say, cause we do wanna encourage people to do it online.
'Cause remember, they have to do it now by December 1st.
Right, and we can be flexible on that, we don't have to.
So how are the people gonna know? You gonna email them and remind them to,
Yeah, so I can actually do,
we don't have all their email addresses, so do we? And with owners changing,
yeah, we can work on a letter now and send it out next week. Snail mail to all of our licensees. And just say, FYI, this is what's happening, and especially for the food people, we can tell them, we got rid of the food regulation. So there's not a late fee, but we do expect that
have they removed it completely?
it's still on the website, but
Because,
the board,
I'm just wondering if we should, unfortunately, I should have suggested maybe just keep it one more year and see how.
yeah. Yeah, so
Because really, I don't know how much recourse you're gonna have. If they don't pay, you can't just go and close them down.
Yeah, you can.
You can try to close them down, but you don't necessarily. Think you have to go to the, get a court order,
well, that's
and
it,
the police aren't gonna back you up unless you do have an order.
right, well, I would issue a cease and desist. And then if they refuse
Then you gotta.
to abide by the cease and desist,
And how long is that gonna take?
we could either go to court
And
or
it's not housing court either.
we could call a hearing and we could say, not only are we shutting you down for applying late, now we're just gonna take your permit and you're never gonna have a license to operate, and then you're shut down forever. So I think that if they know that's what the consequences are in the code, I think as long as we hold by the code. And don't let people do whatever they want, then they'll follow the rules,
But are
And
we
if-
going to do that if they don't have the certifications? Like before we had
right,
we had the fines, if they paid for their permit, but they didn't hand in their
Right.
certifications, we had a fine schedule. So how are we gonna, you're gonna close them down if you don't get their certifications?
yeah,
Okay,
cause that would be, if they don't include their certifications, that would be an incomplete application, and
okay.
send us your certifications. But I think because the regs, the board voted at the last month, and the reg is gone, so.
Yeah, no, I know, but just,
So yeah, but I can send a letter to everyone, at least all the food establishments, and just say, we are moving to an e-permitting system. You should receive more information within the coming weeks.
we're following the-
We've
the
also,
state code.
yeah, we've also
Strictly following the state code.
removed the local regulation regarding food establishments, so there will be no more late fee for not renewing your license. However,
We're gonna follow the
we
state code.
we
so there's
expect
gonna
that-
be closures.
right,
like
applications are due by the state code on December 1st. And if your license hasn't been granted by January 1st, we expect that you will not open your doors until you have your license in hand. And then we can also say.
And include the certifications.
Yeah, and we can also say something along the lines of, this year, because everyone's new to the e-permitting. If you're struggling with it and you can't get your license, your application in on December 1st, if you don't get it until December 15th, we're not gonna penalize you. As long as it's done, as long as you have your license before January 1st, so. But I think that's, it's a big change, so I think it's reasonable to grant some leeway this year.
Absolutely.
But I think that, I had talked to West Springfield and they're even more strict. Cause if someone does their application on, say December 15th, they would make them wait the 30 days before they give them their license. So they wouldn't be able, they'd have to, from the time their license expires on the 31st, they wouldn't be able to be open until the 15th or the 14th of, or I guess the 15th of January.
All right, and
So,
this is just for people.
and that's what was, I'm not saying we should do that,
No,
but
that's gonna be hard. to keep
yeah, that would be
track
hard to keep track
of.
of.
But this is. And for like Malicious, they don't open till the spring.
Yeah, so that, as long
30
as.
So 30 days before they open. Okay.
Yep. But so I'm not saying we should be as strict as West Springfield, but what the director there told me is, they give people they send out ample notices and reminders. So we'll send out a letter next week and just give people the heads up. Once we go live, we'll have more information from Full Circle Technologies regarding how to sign up and everything they're supposed to do.
Right. It's
We'll
kind of-
send out another letter then.
Can I read the letter too that
Yeah.
they're gonna send out
Yeah.
first?
Yeah,
Okay.
so we'll give people, every chance to do it, and we have the computer in the office, we can help them out. If they're having a hard time with the computer. So hopefully it will go well.
Right, unanticipated, anything?
No, I don't think so.
So our public hearing is the 10th. Terry will be there in person. Trish, you're going to Zoom in. Our next meeting is November 7th. Trish, you need to get some rest.
You do.
Yes, yeah, you're sounding worse as the night goes on. Erica, you have anything you want to say?
Not related to the meeting, no.
Okay,
I do have a.
all right, so, okay, I'll make the motion to adjourn the meeting at 8:40 PM.
7:40.
Oh, 7:40 PM, excuse me, 7:40 PM. Want to second it?
I'll second the motion.
All in favor?
Trish Leviniak.
Sue Braska, yes.